Ready? Okay, I'd like to call to order this meeting of the First Five Sacramento Commission for Monday, May 4th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Chair Sarna.
Here.
Christina Elliott.
Here.
Eric Fernandez y Garcia.
Mike.
David Gordon.
Here.
Dr. Casserier is out today. Bruce Wagstaff. Steve Wirtz. Patrick Kennedy. Beth Hassett. Lee Turner Johnson. Donna Sneringer. Kathy Kosick. Terry Porter. Scott Moak. We have a quorum.
Great, thank you. Will you please rise and join me in the pledge? Those that are on the phone, if you can find a flag, you're welcome to join us.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
With liberty
and justice for all.
Okay, thank you. This is the first five commission meeting we've had since our county and statewide stay-at-home orders. And so for those that are viewing, you can tell we are sparse here at the dais today, but we do have a complement of commissioners that are also joining us by phone. I do want to take a moment and issue some thanks as I've been doing at the beginning of each Board of Supervisors hearing. I just want to take this opportunity to thank all of our first responders in our community, especially our doctors and nurses, our healthcare professionals that continue to do yeoman's work in taking care of the ill and those that need attention. So you should know that you have the gratitude of our full commission and our staff. I do have an announcement unique under these circumstances that I need to read into the record. In compliance with directives of the County, State, and Centers for Disease Control and Prevention, CDC, this meeting is live streamed and closed to the public. Temporary procedures are subject to change pursuant to guidelines related to social distancing and minimizing person-to-person contact. Members of the public are encouraged to submit public comments electronically, which will be accepted until the adjournment of the meeting. The clerk's office will distribute electronic comments to commission members, and comments will be filed in the record. You can send comments to the clerk at boardclerk@saccounty.net. That's SACCOUNTY.net. Include the meeting date, agenda item number, or write off agenda matter if the comment is related to an item that is not on the posted agenda. It is optional to include your first and last name. Please visit the First Five Sacramento Meetings webpage for detailed information related to agendas and general information at www.first5sacramento, all strung together, the number 5.saccounty.net. And then lastly, before we get to our agenda, I do want to say special thanks to Carmen. I don't know if she's watching.
She is watching.
She's been doing great work in our community, making masks for our first five families, and I really want to express my thanks to her whole operation. I'm sure it's probably not just her alone, but I have here a first five themed mask that I will wear in good health and with a great amount of pride. So with that,
Thank you.
our first item.
Can I read the replay statement?
I'm sorry?
Replay statement?
Oh, yes, please.
This meeting, the First Five Sacramento Commission, is cablecast live on Metro 14 Cable, the local government affairs channel, on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed captioned and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Thursday, May 7th at 2 p.m. and Friday, May 8th at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may sign up electronically at the back of the room. Please speak into the microphone when addressing the commission and state your name for the record. If you have electronic devices, please turn them on silent or off now.
Thank you. And then for those commissioners that are on joining us by phone, if you could please mute your phones while you're not talking. That would help us here in the chambers. We're getting a little bit of background noise. And then if you would like to chime in, obviously I can't see your hands raised, and I don't see, you don't have the use of the monitor, so I can't see when you're in the queue. But so if you can just interject if you have questions or wish to participate in the conversation. So with that, our first item.
Our first item is approval of March 2nd, 2020 draft action summary. Need to make one quick note. On page 3 of the minutes, item number 9, Commissioners Kennedy, Moak, Turner Johnson, Cossack, Porter, and Hassett did not need to vote in that item, so we will remove those names.
Okay. All right. So with that note, that noted adjustment, does any member of the commission wish to make a motion?
I'll move the item.
Been moved by Commissioner Gordon. The chair will second. Let's do a roll call vote, please.
Chair Cerna.
Aye.
Christine Elliott.
Aye.
Eric Fernandez y Garcia. David Gordon.
Aye.
Since Dr. Caceria is out, Kathy Cossack's voting in her place. Kathy Cossack. Bruce Wagstaff. And Steve Wertz. Motion passes.
Great, thank you. Okay, next item, please.
Second item, recognition of Christina Elliott's service to First Five.
Julie?
Am I on? Clear.
You are now.
Okay, great. I have just a couple of things to say about Commissioner Elliott, and I'm going to try to get through it without tears. She has served First Five Sacramento for nearly 7 years. And when I say serve, she really put her back into her service. She was a member of both our evaluation committee and our sustainability committee, and for several years she was doing that simultaneously, being on both committees. She brings not only her skills and her passion to the job, but she has really made the commission a family affair. Through her, we've had the opportunity to meet both her daughters, Adeline and Harper. They've joined us at the Capitol for the last 5 years to advocate on behalf of our children and families, and we refer to them as our secret weapons, but it really is Christina who's our secret weapon. She's stepped up for families in ways that just go above and beyond the call of duty. And just one example is when she opened her house to us when we were filming our 20th anniversary video. She invited in film crews, and it was just an amazing thing for her to do. So thank you, Miss Chris, for your genuine enthusiasm for all things First Five, and for not only just being a commissioner, but also a true friend of mine. It's been amazing to have you on our team, and you'll be so very missed by everyone. We have put together a small going away gift for you, something visual to remind you of the impact that you've had on children and families in Sacramento. And there's a little something for your girls in here too, who've made Advocacy Day very memorable for us for the last 5 years. And definitely memorable for those legislators who had to clean their carpets after the girls left. We definitely wish you the best of luck and excitement on your new adventure. So I'm going to leave this here, and then you can come up maybe? Okay.
All right, we could all applaud.
Can't really see it, but it's a photo collage of Commissioner Elliott at the Capitol on Advocacy Day, here presenting to the commissioners in board chambers, and just with some of the staff. And then finally, there's a little something to do with ice cream in Columbus, Ohio.
Nice, very nice. So I'll just add a few words here. A very nice presentation, Julie. So I've had the opportunity to serve now as chair of this commission for almost a decade. It's hard to believe. And I've served with a number of commissioners, some who have certainly predated my time here on the commission, and others that have come and gone. But I have to say, Christina, you've really, I think, led us in ways that may not be obvious to some, but certainly been very obvious to me. And when I say that, I mean leading by example. You're a parent, a great parent, and you're a parent that serves with a lot of pride. That's obvious. And that comes through in your service, and it means everything to all of us on the commission that you've given of yourself, given of your time. You've sacrificed time away from your family to help your broader family here in Sacramento County, and we wish you all the best in your future endeavors. Any others on the phone want to help with the tears here?
Yeah.
Commissioner Gordon?
I just wanted to say a big thank you to you for all of your support to our early learning leaders in Sacramento County. Many's the time you left your family and came to speak at one of our early morning meetings and conferences, and you always spoke eloquently but from the heart, and reflecting your commitment to making things better for all of our young families and young parents. So you have you've contributed so much, and we're so grateful for knowing you and having you with us.
Any others on the phone?
Ditto.
Do you want, Christina, do you want it?
Sure.
She's making her way to the podium here.
Trying to avoid people.
I know, it's hard.
Trying to do it very carefully.
Oh, okay. This moves down, right?
The whole thing does. Does our clerk know where the button is?
Oh.
No, on the side.
Oh. Sorry. Thank you. I'm moving this down so I can actually reach the microphones. Sorry, I'm crying. I really thought I would be on this commission for as long as I would be allowed. So this certainly wasn't in my plans even, last fall. I've said this several times over the years, but I certainly have my day job and obviously my kids, but this has been a real passion of mine, and it's been a huge opportunity for growth for me personally to sit beside you, Chair Cerna, Dr. Gordon, everyone on the phone. I've learned so much from all of your leadership and your passion for people. And it isn't often that you find people that you share beliefs with, and in random circumstances like being elected or appointed. And I just feel like, or it's obvious that this commission, specifically in Sacramento, is more than just a body, a government entity. It is a driving force across the nation. We're setting example for what our priorities should be as a society. One of the things I looked into when the recruiting firm first contacted me in December, after I talked to my husband, and he actually encouraged me to pursue this position, was, what is the diversity of Columbus? What are the things that they are going through as a community? What can I contribute? Because I grew up in Sacramento. I never thought I'd leave Sacramento yet, or California. I'm not one of those people that hates California. I love California. So I'm not leaving because I don't like it here. I absolutely love it here. It's an amazing, wonderful place. And so is Sacramento. But they do have a lot of the same problems that we have, and the disparities and the awful inequities across racial lines and across all different kinds of financial, struggling to find the words because I'm like shaky. But I hope to take what I've learned from you all and do good work there and help moms there and help people there. I can't do this same type of work at this level, but hopefully I can be a small voice in a pond that I'm not used to and become something more there that I can contribute more to. I wrote down things to say about all of you and realized that it would take all day. Truly. I've been writing thank you cards to all of you on staff and on the commission. So I'll be mailing those to you because I won't put you all through that. I will say, Scott, when I first learned that I was going to be Scott's alternate, I felt very cool because he is a celebrity, and I thought that was the coolest thing ever. I was super excited, and Scott has been a wonderful mentor to me as well as his alternate all these years. Now I'm finally able to vote in this. I move out of state, but I'm just very grateful for all of the opportunity I've had. Julie, thank you so much for your friendship and your leadership. I don't really know how else to articulate my thoughts, but I do have cards, so I will spare the public my tears. But thank you for allowing me to serve, and I hope to come back.
You're always welcome.
So yeah, I'll come back for hugs.
Great.
When we can hug again. So thank you.
Thanks, Christina.
Is this mine too? No.
Yes, you can take all that. Let me do one quick picture. Strangely empty.
I know.
Thank you.
Thanks again, Julie, for that really appropriate acknowledgement.
Absolutely.
Okay. Next on our agenda, comments from the public on items not on the agenda. We don't have any comments electronically, do we?
No.
Okay. Then we will move on to the executive director's report.
Fantastic. So welcome to our first ever hybrid meeting, which is so strange to not see all of you, all of your supportive faces up on the dais. But I have spoken to most of you over the last month since the stay-at-home order went into effect, and I just wanted to take this moment to thank you all. Commissioners have been my thought partner, my mentors through this. I've reached out to you on so many different levels, and really appreciate you being there for me and for the staff during this time. And a lot of my report focuses on the pandemic. I'm not going to read through any of the things that are there. I'll just kind of share with you some of the sort of everyday things we've been doing. It has been a bit overwhelming. There's just so much information coming through, and surveys to take, and webinars to attend, and webinars to lead now, and trainings. So staff have just really been communicating with our partners weekly, and providing resources and emails with links to resources, and just being very flexible with scopes of work and budgets and all of that, as we know you would want us to be. We're excited that pretty soon, we hope, in fact, like right now during this meeting, Child Action is in conference with supplybank.org, figuring out when we're going to get our first shipment of supplies. So we will be able to distribute diapers, wipes, hand soap, sanitizer, disinfectant, masks, formula, a myriad of things that came up as a huge need for our families. These supplies would go to our providers directly, and then from the providers, some probably kept in-house so that they can remain open and serve families, and then some directly provided to families. So we're also pushing out just resources at hyperspeed on all of our social media platforms. And another exciting thing, something we've been wanting to do for a long time, but really became very motivating for Persimmon to work with us on. So Carmen has been working with them to, instead of having these consent forms and family information forms and duplicates and triplicates, we finally now convinced them to work so that it's just a link, and the link is going to be sent to each family from the provider. Once the family fills it out, either on their smartphone, on tablet, on their computer, their information is automatically uploaded into Persimmon, so it's cutting back on all kinds of data entry that the staff were having to do prior to this. And then the staff get an electronic notification that the family has responded, and then they can follow up and provide services virtually. So it really has been a very good thing we've been able to do. We hope to launch it in 2 phases. We're starting with the family information form, and then moving on to the consent form. We're starting next week in English, and we will have the Spanish version available very soon too. As you know, we surveyed our contractors to sort of find out what their needs were, and how we might, as a commission, provide assistance to them. That's where we came to understand that 100% of them are still providing services in some way, shape, or form, and 75% of them still have their doors open and are seeing families on a limited basis, face-to-face basis. So they identified things like formula and infant food and infant formula, tablets and technology to reach families. They needed cleaning supplies, financial support, and distance early learning supplies. All things that we're working with them either to provide directly or within their budgets, allowing them to make budget adjustments so that they could purchase the things that they need to reach those families. Let me see what else. In addition to what we're receiving from First 5 California, because that was in partnership with First 5 California, those supplies that we're receiving. We also have some masks, which Phil shared at the beginning of the meeting, handmade by Carmen. She began making masks to give to families and friends, anybody who needed one for free. Pretty soon donations started coming in, and she was able to parlay that into making more and more masks, as well as hiring small family-owned restaurants to cater first responders. So providing food and masks to everyone in need. As of today, she's sewn almost 400 masks and
great.
raised $2,000.
That's awesome.
So we will start with a limited distribution of the masks through our family resource centers when we provide the other.
So I note on mine, it says size adult large. Does that mean I have a big mouth?
Yeah.
Carmen, are you trying to tell me something?
It's funny. And she's made the mask to fit children too, so 2 to 5-year-old children as well. So adult and pretty cool. For national and state updates, I've listed some of the more pertinent things in your executive director's report, but I've also asked Commissioner Sneeringer if she would share a little bit on the highlights of recent actions taken around childcare. This was one of the first things that everybody started talking about when the shelter-in-place order came about, and she really has a pulse on what's happening. So, Commissioner Sneeringer, could you chime in? Just a thank you very much, Donna. One other COVID-related thing at the state level, and then wanted to just talk about some non-COVID related things as well. So on last week, the governor, earlier on April 13th, the governor had announced $42 million to support foster care children and families during the pandemic. And then last week, of that $42, he allocated $2.8 million that was going to be a set aside specifically for family resource centers. They could use these funds to distribute material items like food and diapers and parenting resources. They could use it for their staff time to help link families to other supports. So just a little bit of funding. The applications are due tomorrow, and certainly our family resource centers through CAPSU are applying for this funding. So that is wonderful. And as far as non-COVID related topics, our First 5 family grew by 1 last week. We had a strange time for a new employee to start, as you can know, Miss Chris. Troy Coronado joined our team as an ASO2. He replaces Michelle Peterson, who retired after 32 years with the county in February. And so Troy comes to us from the Department of Finance, where he was an ASO1 prior to this. And we're super happy to have him on the team, and I'll bring him to a future meeting to meet you all. I also have good news around home visiting, our home visiting efforts. Last fall, First 5 California awarded $24 million to support county commissions in strengthening our home visiting efforts to draw down funds from the federal and state allocations, as well as to just strengthen and make more effective our home visiting programs that we currently have. So Friday last, we were informed that they're going to be releasing a non-competitive RFA for county commissions. It's approximately $100,000 a year for the first 2 years. And those funds, again, I'm sure there is a number of things that they're going to outline. They haven't released it yet. It's being released on the 11th. But we're really looking forward to it. I've already reached out to our colleagues who also are major funders of home visiting in the county, so the Department of Human Assistance and Department of Child, Family, and Adult Services. I reached out to Public Health and to SETA. And with those home visiting programs, the leaders of those programs are going to get together and talk about reinstating a home visiting coordination council and some other things. And then we'll be inviting all of our partners to the table. So exciting there. We did have our virtual advocacy day on April 21st, and we met with Senator Pan and staff from McCarty's office, Cooper and Cooley's offices virtually. It was interesting, but I think they went well, and we certainly got to talk. They were very eager to hear what our families' needs were out on the street level, and how our agencies were providing services now. We had a Dia de los Niños virtual celebration. I don't know if any of you had a chance to watch it. It was pretty funny. So the first partner, Jennifer Siebel Newsom, read the Census We Count book to her 2 children, 4-year-old and 6-year-old. And that was hilarious. It was lively. It was real world because her kids were kids. And so it was pretty funny. But anyway, it was pretty successful. There's some 77,000 views of the video so far and still climbing. I've been watching. If you want to laugh, check it out. And lastly, our census, with the shelter in place, our outreach strategies for census have really had to evolve and have shifted, making our social media efforts way more prominent now. We've combined messages related to the Census 2020 and hard to count communities with a COVID message, because everybody's hearing COVID, and we thought we could sneak in census with COVID. And we wanted to say thank you to Commissioner Fernandez y Garcia. He distributed 1,000 of our We Count books to pediatric offices in UC Davis system. So that was amazing. And the census deadline has been extended to October 31st as a result of COVID. And I thought I would close my report with a very brief video on the census to share with you. Those of you who can see, who are live streaming anyway. We'll see if it comes up.
Is there audio?
As it says, please listen.
Nice.
There you go.
Great. That looked very well produced.
Yeah.
Does that conclude your report?
That does.
Okay, very good. Thank you. Any member of the commission wish to comment on our ED's report? Not hearing anyone on the phone. Yes. Yeah.
I didn't bring the numbers with me, Commissioner Wirtz, but we have been getting excellent feedback from it. Lots of hits, and Aaron would know what to say where the click-throughs, people are clicking through at higher rates than industry standard, and even more importantly than that, they're actually staying on those sites like 3 and 4 and 5 times longer than industry standard. So if we think they're reading it. And then there's been a lot of interactive activity and comments on our Facebook, or not Facebook, on the social media. They're using Instagram, I think, mostly, sites. So folks are responsive overall, and we are looking at how to use our funding for next year to continue what we're doing, as well as to remind folks that we still do have Sac Healthy Baby, and how to make even more of a connection between the unequal birth campaign and then connecting moms to services in their community. So you'll see a little bit of both of those campaigns going next year. Yes, you're correct. A much better response, yes. Happily.
Any other questions for Julie? Okay, hearing none. Let's see, we need to do a vote on this as well. We're going to do everything with roll call today.
We're voting on the director's report.
It says vote.
Very sorry. That's
Okay.
just a receive.
All right.
Sorry about that.
Okay, so next item, please.
Advisory committee update.
Our committee did not meet since our last meeting, but we have a virtual meeting set up for June 10th. But hopefully we might be meeting in person. Fingers crossed.
Evaluation committee update.
Okay, thank you. Financial planning? Thanks, Kathy. I have a question. I'm not sure if it's best posed to you or to Julie, but when do we expect we will have kind of a foggy crystal ball to look through in terms of our principal revenue stream that comes from the Prop 10 tax? I know that at the county, our budget process that we usually go through each June is going to be fairly perfunctory this year, status quo, if you will, because we just don't have a clear picture whatsoever of our revenues in light of the pandemic. So will California First Five be able to give us some insight in terms of what influence the pandemic's had on smoking cessation or how people prioritize their discretionary income spending?
Right. So, okay, I'm going to leave it to Eric. I'm going to push that can down the road.
We haven't heard any studies that have been done on the public's activity, if they've been smoking more or less. We haven't heard anything. I haven't heard anything from First Five California or the Department of Finance at the state level. But that's where that information will come out of first. And so we'll definitely keep our ears open and start, once we start hearing something, we'll definitely keep the commission informed on that type of information.
I appreciate that. Do we have an understanding of like which quarter of the year we might see that information become available?
Well, they're pretty quick on how much they've collected in a month, at least in keeping that information. They don't necessarily pay us that quickly. But we can check with contacts we have at First Five California or the state just to see what kind of revenues they do an initial analysis, and then they revamp or they take another look at it before they make it final. Mm-hmm. But we can definitely put some feelers out there and start seeing what their revenue collections look like for these current months.
Yeah, I think the earliest that we can understand what our revenue picture looks like, the better for us in terms of our just ongoing budgeting,
Absolutely.
of course, but also if we have to, if we find ourselves in a position where we have to make some difficult decisions, I want to be able to have this commission deliberate that as soon as we can.
Yes.
So, okay, thank you. Then we're on to sustainability. Very good, thank you. Okay, item 9.
Approval of community connections grants.
Great. Alejandra Librado is going to take this one for the team.
Oh. You've got a sign on your back.
That was great.
Who knew that? Who knew we were in the novelty gag business?
No, it wasn't them. They're behaving. Is the mic on okay? Okay, great. Okay, in case you did not remember, I am with county staff. So good afternoon. I hope all your families are healthy and safe at this time. I wanted to bring to you the CCG groups that we are recommending for funding. This will be the final CCG round, as it will no longer be funded by First Five into the next strategic plan. So although this does bring us some sadness, because we've seen so many of these groups develop and move on and really go above and beyond. So we're very proud of them. But we are happy that we're going to continue to support some of the really top-notch group leaders with the guidance of Lead for Tomorrow, to just support them because they have expressed an interest to continue civic engagement and participation in their community. So we wanted to support them. So Lead for Tomorrow, who currently leads our parent support groups, is going to work with them as gatherings, and then we hope that will just build a strong foundation of community leaders that will sustain way past the 0 to 5 years. The groups I'm about to present for recommendation of funding are part of the 9th round of CCG, since it was relaunched in January 2016. This will make, I believe it's 63-ish funded groups. And we've discussed with them also opportunities to, if they're willing to modify any of their activities during the current situation with the restrictions of social distancing, and they've all agreed to. We're proud of some of the existing groups that have done some really nice things with their groups, having virtual play groups, doing drop-offs of arts and crafts and things like that. So they've gotten really creative to keep families engaged and active. They didn't just throw in the towel and say, okay, we're too busy for this, we just need time off. They wanted to continue and move forward. So these new groups also would like to have that option, that if the situation is still iffy, then they will also modify their activities. Just please know also that the budget amounts that you have in front of you on your charts, these are amounts that were requested. This is not necessarily the amounts that we are going to fund them for. Some may be partially funded, but since we haven't had the chance to meet with them yet, we haven't discussed any of the negotiating factors. These groups are watching the meeting live since they can't be here personally, so they are watching. Is there any questions before I present the groups? And I'm just going to give a very brief statement about their groups or my own. Any
questions from commissioners on the phone? Yes, please.
So one example, sure. One example, what a lot of the groups have picked up is, for example, if they have an activity that would normally have been done in person, their group leader is dropping off on the doorstep some items, and together through like a virtual play group or activity, the group does the activity and can show off their item. There's been virtual play groups, quite a bit of them. So that's mostly where there's a lot of social media contact, but the funding, there hasn't been a whole lot of expenses, but there are some with those, such as the example that I gave, is using arts and crafts or things that the child can do with their families. Books is also, they're doing story times as well. And so they may drop off a specific book so that the family can read together. Yes, so this specifically would not be to continue to fund CCG as we know it. This is for the, like I said, the top-notch group leaders that just have expressed that interest to continue to be involved, to be mentors. And these group leaders have done more than their CCG group. They have been grant reviewers for our CCG program. They have been spokespeople for several times, and they've also been mentors for our other CCG groups. So they have a potential to make a difference in the community, again, way beyond 0 to 5 year, way beyond CCG. So the funding, some of the funding opportunities that I believe that they have looked into, there are some of the health insurances who have community grants. Western Health Advantage is one that sparks my mind. So I know through, I believe, the Sierra Health Foundation. So there are a few that they've already kind of started getting the ball rolling. So this will just launch it, maybe start at the foundation or create that forum that we can all tap into, and we hope to build on it when Lead for Tomorrow can continue that after June 2021.
Any other questions from commissioners? If not, I'd entertain a motion.
I'll move approval.
Been moved by Commissioner Gordon, seconded by Commissioner Elliott. Roll call vote, please.
Chair Cerna.
Aye.
Christina Elliott.
Aye.
Eric Fernandez y Garcia. David Gordon.
Aye.
Kathy Kosick. Bruce Wagstaff. Steve Wirtz. Motion passes.
Great, thank you. Thank you.
Sign back.
Okay, next item, please.
Sorry. Approval to enter into a revenue agreement with Sacramento County Department of Human Assistance for the CalWorks Home Visiting Program and to execute an expenditure agreement with Child Abuse Prevention Council.
Okay. Okay, noted. Thank you.
Okay, good afternoon, commissioners. Item number 10 on your agenda is asking for you to authorize Julie to execute a fiscal year 2021 revenue and expenditure contracts for the CalWorks Home Visiting Program. The total CalWorks award to the Department of Human Assistance for fiscal year 2021 was $7.6 million, of which $1.5 million will go to the Nurse Family Partnership at Public Health. $1.4 million will be held by DHA for future allocation, and the remaining $4.7 million will be allocated to First Five in the form of a revenue agreement to pay direct service providers and monitor their contracts. Up to $240,000 of the $4.7 million can be used by First Five to reimburse for costs associated with oversight of the program. First Five will contract with Child Abuse Prevention Council in the amount of $4.45 million to provide home visiting services through the Birth and Beyond Collaborative. This represents a $700,000 increase over the fiscal year 1920 contract with CAPC. This concludes my report, unless you have some questions.
Great, thank you. I'm going to remind commissioners on the phone, if you're not speaking, please mute your phone. We're getting background noise again here in chambers. Thank you. Okay, any questions for staff? Any questions from those on the phone? All right, I'll go ahead and move the item. Is there a second? Second by Commissioner Elliott. I'm not in receipt of any public comments on this.
No.
Okay, I should have noted, by the way, for item 9, I do have one written public comment from Crystal Harding, so that's noted for the record. All right, we have a motion and a second on item 10. Please call the roll.
Chair Cerna?
Aye.
Commissioner Elliott?
Aye.
Commissioner Garcia? Commissioner Gordon?
Aye.
Commissioner Cosick? Steve Wertz?
Yes.
Yes, got it.
Who's the alternate for?
Terry Porter? Motion passes.
Okay, great, thank you. Item 11.
Approval of first 5 Sacramento 21 to 24 to strategic plan.
And hello again. I have a brief PowerPoint presentation to walk you through about the strategic plan. I'm pleased to present it to you, and a full copy of it is in your packet. The plan is our Commission's roadmap to ensure that we fund comprehensive services, prevention and early intervention services for kids and their families. So I'm just going to go through these quickly to show you a reminder of how we got to this point. In February, the Commission approved the elements of our strategic plan. Those were our mission and vision shown here, as well as our strategic principles, our strategic plan hierarchy, and our $44.6 million spending plan. We also approved the allocations to each of the 7 result areas. On April 7th, the Board of Supervisors received the strategic plan for review and comment. Typically, I would have presented to them, like I'm doing for you today, but due to COVID, they weren't receiving presentations at the time. So they did receive it and did not have comments. Also, during the month of March, we did have several community input sessions scheduled. We ended up conducting just 3 of the 4 because of COVID, and they weren't heavily, there wasn't a lot of participation, but we did have 15 individuals rather, who participated, the majority of whom fully agreed with the various components of the strategic plan and those result areas that the Commission had approved. When asked if there was anything missing or what they would also include, they mentioned things like nutrition, education, and counseling, car seat distribution, puppet shows, singing, music, playgroups, mental health counseling, both perinatal, postpartum, and early childhood, as well as always affordable child care funding, specifically for affordable child care. So these should look familiar to you. These are our strategic funding principles. They were developed by the work group and approved at the last meeting. And these are what the work group really used to guide them through the creation of the plan. Another reminder of our graph, which you all know pretty well. It clearly depicts why we have fewer dollars at this time to invest in this strategic plan. And that's primarily due to a combination of our declining revenue, but most importantly, our strategic spending down of our reserves. The 2021 plan has a 25% reduction overall, and this is the second of 3 step downs that are planned, with the next one beginning in 2024, the final one.
Julie, can I ask you to go back to that slide? So what do you tell someone that just has the benefit of seeing this slide without much else, when they see expenses, the expenses line above the income line and the reserve below both of those. Because that would seem to indicate to most people, well, this is an insolvent situation.
To me, it really represents we're no longer going to be able to use reserves to back fund us anymore. However, that green line is our incoming revenue each year. We're just getting closer and closer with that blue line to just giving out the money that's coming in each year. And that's just kind of how I explain it. Our reserves are going to go down to $3 million, where they will stay, because that is what our commission has agreed on will always be our minimum reserves. And our funding allocation, that represents about a 2% decrease per year, and we're just getting closer to only spending that amount.
Gotcha. All right, thank you.
You're welcome. So what are the major differences? What's changed from our current strategic plan to this one? Of course, the $5 million reduction in our annual operating budget. Additionally, the commission approved eliminating 2 result areas moving forward. Now the dental result area will be is still part of our bigger picture, but it will just be addressed through systems level work and not through direct service funding. And as Alejandra mentioned, the community connections grants are no longer, they will culminate at the end of 2021. Additionally, all the other result areas will be decreased from 25 to 40%, with the exception of result area 1, which is our efforts to reduce African American child death. That one does stay whole. First 5 is also making internal reductions across our admin, evaluation, and program line items. And that's reflective of reductions in staffing, operational efficiencies, and reductions to materials, media, and supplies going forward. This is what our new strategic plan hierarchy looks like. We narrowed down from 10 result areas down to 7 result areas. And we will fund under 3 main areas of health, early care and development, and empowered families. And each one of those has several result areas underneath it. And consistent with the current strategic plan, we're actually doing, you can see that there's some that are just green, and those are only policy and systems level result areas. And then the others are a hybrid of both direct services and systems level work. I will move us. This is the 3-year spending plan, also approved at our February meeting for $46.6 million. And I'm going to tell you about that. This represents 90% of our investments going toward direct programming, 7% toward administration, and 3% toward evaluation, which is consistent with our current plan. We based on these projections, it's anticipated we'll start with a reserve balance of $11.7 million going into the strategic plan, and we end with a $3 million that will be reserved from here and on. This is a new one for you that I wanted to add. It's just a little bit bright. This is our planned program expenditures. And this demonstrates how the remaining 7 result areas, along with our other related costs, all total up to be our total program budget. So as you can see, I've included the percent reductions that were approved in February. That's in the 2nd column. The 3rd column indicates the 3-year funding allocations per line item. So that's the total that would be allocated in the strategic plan. And the 4th column identifies the overall percentage that program takes of our full budget. So for example, in result area 1, to our efforts to reduce African American child death, it received no reduction. It's funded at $3.85 million over all 3 years, and it represents 10% of our total budget, program budget. And it's clear, you can see from this, that our two largest program areas are effective parenting at 46% and school readiness at 25%. Beginning on page 10 of the actual strategic plan document, you'll see that each of the 7 results has a page dedicated to it, covering the specific topics that are on this slide, which are the priorities, the goal, and the result. Rather than reviewing all 7 of them, I thought that I would walk you through an example of one, and then you can kind of follow along in your packet to see the rest. So we're going to look at result area 2, which is to increase prevalence and duration of breastfeeding. And what you can see across the top is the need, and we have a graph in there that will demonstrate why it's a need to continue to fund in this result area. There are 3 indicators will be tracked related to breastfeeding. And we've identified 2 potential direct service and 3 potential sustainability strategies that we would look at in the implementation plan. And my only caveat here is that some of these potential programmatic and systems level strategies may change given COVID. We clearly created this plan before COVID-19. There will undoubtedly be some new directions, maybe some new strategies that we're going to be using, might be some new target populations that we need to focus on, and those things we will address in our implementation plan. So this is, if you think about the strategic plan as that 30,000 foot level where we're saying these are the important things to us to invest our money in, how we do that becomes apparent in the implementation plan. And wanted to share a few things that we learned during this strategic planning process. We saw that our needs and the disparities of those needs persisted in some specific ways. And you can see it: dental and health utilization, birth outcomes, as well as maternal morbidity rates, our breastfeeding rates, preschool access and school readiness, and child maltreatment rates. So those are just things that some we knew and some we became more knowledgeable throughout the process. Clearly, we can't meet all of our community's needs alone, and this plan helped us identify the areas where we need to tap into our partners to help in our efforts, including some of those things that the community groups shared with us that were important when we brought the strategic plan to them, like nutrition, education, and car seats, and mental health counseling, and as always, affordable childcare. Finally, we can and we have to be more strategic with our financial resources. We continue to make that really important pivot from direct services to direct services and systems level work. That's critical that we continue to do that. We are always looking for additional funding streams to come in and offset the Commission's direct service investments. The home visiting dollars were an excellent example of that in the current strategic plan. We will continue to look for that in our future plan. And this is a slide that I shared, that I plan to share with the county, because First 5 is a part of our county structure. So we, in previous years, as you all know, we stepped in to help fund some programs during the 2009 recession. We had the reserves to do that, and we gladly did it. And now with our reserves decreased by the end of this strategic plan period to just our bare minimum, unfortunately, we really don't have that opportunity this time around. And there are some county programs such as WIC and Birth and Beyond and even Black Child Legacy that we co-fund together, and that could be impacted by the reductions made in our 2021 strategic plan. Even though Black Child Legacy campaign funding was not reduced, a flat funding level in a whole new 3-year cycle does mean that there are some just inherent cost of living increase challenges that will be seen in others. The new plan just continues to shine a light on the importance of proactively working on our sustainability efforts to maintain those critical services that we're no longer able to fund. And that's our systems, our policy, and sustainability work, and making sure it's ingrained in all of what we do as a commission, but also what is happening with our contractors. And that is my presentation to you.
Great. Thank you, Julie.
Any questions?
Any questions for commissioners on the phone?
Sure. We just heard this morning, that UC Davis Health, which is one of our last holdouts for becoming a baby-friendly hospital, is in fact a baby-friendly hospital. So we're really excited that started with our efforts almost a decade ago, I think, to work on that systems level, and that is something that stays and is in place now and will continue to serve those moms and their babies. So we're excited about that. You're welcome.
Other questions? Not hearing any. I just want to express my thanks to you, Julie, and to Carmen and all the staff that worked on this. I know it's hasn't been an easy plan to come up with, and we've had some interesting discussions about some of the nuanced adjustments that have been made and that are reflected in this. But I guess it is somewhat thematic to our existence as a First Five overall, and that is we have to be very nimble and willing to shift when we need to continue to carry out our mission the way we envision. So my thanks to you for doing a great job.
Could I say a word?
Yes, please. Commissioner Gordon?
Yeah, I also want to commend you, Julie, but you, Chair Cerna, and the Commission, because not only is the plan strategic, I think the activities have turned to become much more strategic. Something like the Black Child Legacy campaign grew out of an entirely related but different objective and has now produced the foundation of a strong source of community activity, which is being applied over and over to many other issues. And to me, that's what being strategic is all about. So I'm really proud of that, and I'll move the item.
Okay, been moved by Commissioner Gordon. Chair will second. If there are no further questions from those on the phone or comments, we'll go ahead and do a roll call vote.
Chair Cerna.
Aye.
Commissioner Elliott.
Aye.
Commissioner Garcia. Aye. Commissioner Gordon.
Aye.
Kathy Kosick. Aye. Commissioner Wagstaff. Aye. Commissioner Wirtz. Aye. Motion passes.
Great, thank you. All right. The next item, please.
Public hearing, adoption of the fiscal year 2020 to 2021 recommended budget and 10-year financial plan.
Okay.
Okay, good afternoon, ladies and gentlemen of the Commission. My name is Eric Harold, Chief of Administration, First Five Sacramento Commission. I know we've kind of already talked about this a little bit, but I'm going to go ahead and state that this budget was created prior to any knowledge of the COVID-19 virus, and so any of the impacts that the COVID-19 has with the budget will be addressed in the final budget, which we'll start working on in July, and it'll come before the Commission in August. And I'll endeavor to get as much impact information as I can by that time, and it'll all be reflected in that budget process. Also, I'll remind you that this is the third and final year of the 2018 strategic plan. So this represents the final year of that plan. It is very much a prescriptive process when the strategic plan is made. It's basically figuring out our strategies. Then the implementation plan tells me pretty much how I'm supposed to write our budget. So I make sure that this budget reflects what's in our implementation plan. And then it also has some changes that whatever kind of actions the commission has taken, it's also reflected in the budget because it is part of our budget request. And so we'll kind of cover that as we go through the attachments. And with that, we'll go ahead and look at attachment 1. Hopefully everybody on the phone has their attachments with them so they're able to follow along. Attachment 1 is the budget summary. And for the fiscal year recommended 2021 budget, we are asking for allocations in the amount of $24.14 million. And the basic breakdown of that allocation is 4.6% goes to administration, 2.1% is evaluation, and then 93.3% is program activities. You're able to see just beneath that how each of the programs are broken down with a total percentage of the budget and then also the total amount requested for each program. I'm not going to go over those individually. You guys can take a look at that, though, if you'd like. In the bottom right-hand corner is the call-out box for the effects that this budget request will have on the reserve balance. Basically, we're looking at starting the fiscal year 2021 with $18.7 million in the reserve. We're looking at an estimated $2.7 million fund balance. And then we will require a reserve release of $4 million for a total assistance from the reserve fund of $6.7 million for the fiscal year 2021. So if we move that blue total over to the revenue side and look at the rest of the revenues, which is $17.4 million, and add it with the reserve financing, we come up with a total funding of $24.14 million, which is equal to the allocations that we're requesting in the budget. And then one further note is at the end of the fiscal year 2021, we estimate that the reserve balance will be $14.7 million. If you go ahead and move on to attachment 2, the budget detail. I'm going to kind of just go over this and talk about the changes and the causes of those changes for when comparing the current year budget with the requested fiscal 2021 recommended budget. So basically, we'll look at the object level on a whole, and we'll start with the object 10, which are your salary and benefits. And that's pretty much the first 15 accounts or dozen accounts, and they're summarized on the yellow row. This, for all of the salary and supplies, our budget request has increased by $56,000. And the primary increase was due to higher healthcare costs for our staff this year. There's a background effect of the cost of living adjustments, but we also took on some new employees who start at lower steps, so those were kind of offset. The cost of living adjustments were kind of offset by newer employees being at a lower step in their classifications. The next group of general ledger accounts I would like to look at are the object 20s, which are our services and supplies. And these are pretty much our operational accounts. And the biggest one you're going to see is the green highlighted one. And that is our contracts where we pay our direct service providers. But before I get into a little detail on that, I would like to talk about, you're going to see some accounts in here that have zero budget history in the first 3 columns, and then all of a sudden we're requesting a budget for them. And the reason that's occurring is because the county switched to a new budgeting system this year, new software. And I think they felt like it is a good time to kind of correct what they do with how they handle these accounts, you'll notice a lot of them have ACP in the title, which stands for Allocated Cost Package, which is an allocated cost. Well, before we'd have an account, say it's IT support, and we would get our allocated costs that hit that account, but then we'd also get direct costs that hit that account whenever we ask for a specific project to charge us directly. And so this, I believe, is essentially separating those two costs, the direct costs with the allocated costs. So we do have those new accounts. And then conversely, you're going to see some accounts that have 3 years of budget history and then all of a sudden have 0 requests for this year. Those are the accounts that are getting moved into those new accounts, or at least some of them. Then if we take a look, the major change with the Object 20s is they have decreased by $1.8 million. And most of that is created from the direct service providers, which is the green row. That has basically went down $1.8 million, and I will discuss a little bit why. First off, we used to have the Perinatal Equity Initiative budgeted in there, and that was a $250,000 one-time funding that's reduced out of that budget request. We also projected that Golden State Water would finish with their capital projects, which is another $1.35 million reduction in that account. Now, we received that report prior to COVID, and then we're due an update in May, I believe, from Golden State Water, so we'll see how well that project's doing. Nonetheless, that'll be updated the way it needs to be in the final budget process. For this budget, it's reduced by $1.3 million there. Then we have a $100,000 planned reduction in our dental contracts. And then finally, we have a $120,000 reduction that is really a paper adjustment, because when we took on the CalWorks grant last year, it was in mid-budget process, and when we requested the appropriations adjustment request, they lumped all of the money that was available into this contracts account, when in reality $120,000 were supposed to go into other general ledger accounts. And so this is kind of just fixing that little adjustment. So that's why the Object 20s went down by about $1.8 million. And then finally, if you take a look at the last group of accounts, which are your Object 90 accounts, those are our revenue accounts. There's about 7 of them close to the bottom. The net result of the Object 90s is really a $330,000 reduction. And this is caused by a reduction in MA revenues of about $200,000, and MA is that Medi-Cal administrative activities. And then also another reduction in the Prop 10 projections of by about $263,000, so not much. And this is also offset by $132,000 of increased interest income. Now, this is kind of ironic because I listened to everybody telling me, 1% is too low to estimate on your interest income, and I thought they had a good point. So the minute I change it, pandemic happens and the market drops, and so but
So it's all your fault, huh?
it is, it's all my fault just by doing that. So we'll take a look at the impacts and also adjust that in the final budget process. So moving on to attachment 3, the 10-year financial plan.
Before you do that, I believe Commissioner Elliott has a question.
Just really quick, since you mentioned it,
Okay.
On the first attachment, I was looking at MA claiming at $700,000, and then as we're talking through, I know you don't have a prediction around what COVID will do to the MA claims, but are there any indications that it will be impacted negatively, like that revenue that we anticipate?
I think the impacts aren't going to be mostly from COVID. I think they're going to be mostly from circumstances around the program. We have CalWorks has come on, and so a lot of focus has been switched. I don't know what the impact's going to be yet, but I know early on they had to shift staff over to that funding source. We've also had just some some things were changing around about how we're claiming. We had to, through our audit, we had to claim a little bit differently, so we had to recognize more revenue earlier because we weren't recognizing all of our revenue. So once we did that, now we kind of expect only 3/4 of revenue in this current coming up here, 3/4, I believe, because I think we collected 5 in the prior fiscal year. So it's just a timing issue, and with what's going on with the home visiting program, it's just changing things up. But we are looking at ways of kind of addressing that and getting the revenue to come back up. Plus, the first cut, our first fiscal cliff is hitting right about now. So there's like $4 million less or so that is available of what they call public funding. That's public eligibility funding, or certified public funding. That's it. So anyways, there's a whole list of factors of why it's changing.
My thought was, gosh, everyone's working from home, and includes every one of those people that are processing claims. So I don't know if you just caught wind of anything like that, but it will be what it is, I suppose.
Yeah, I think, and Julie had mentioned that there are, there are workarounds and different ways of doing business. So they're still trying to do things like that. And we're exploring all kinds of ideas, even like we put the question out to CalWorks if maybe we could buy tablets to put to these homes so they could, things like that. So we're exploring all kinds of options to make it a reality.
Sorry.
That's okay.
It's a good question. We're also.
Yeah, go ahead, Steve. Yeah, I can explain that, Steve. Early on, we had our Prop 56 backfill come into us, and it came in considerably larger than what we anticipated, which put us on a straight line estimate that we were going to be about 1.3 million. We're still pretty close to that. But, I don't, we've talked about, I don't know what COVID's going to do for these last few months. But the primary reason we're seeing that big jump on the Prop 10 is because of the backfill surprise. Now, are we going to get that every year? We're not sure. We've been in lots of meetings with First 5 California, State Department of Finance, CDTFA, First 5 Association, where we've all been talking about this issue, and we're still trying to figure out who's coming up with the methodologies. Are they being calculated correctly? Just all sorts of things. And they've even talked in the last meeting I was in of hiring specialized auditors to go to the state and figure out if their methodologies are being applied appropriately. So I wish I could give you concrete answers, and because everything for my mind is all cut and dry. This is okay. This is how it's supposed to react. These are the statistics. These are the numbers I need to apply. But it's not like that. It's always back and it's up, it's down. And I can't. It's hard for me to explain those sorts of things. But that's the environment we're working in currently.
Understood.
Okay, good. All right, with that, I'll move on to attachment 3, the 10-year financial plan. What do I call this? 10-year financial plan. Yeah, that's it. So basically, the green highlighted column is the current fiscal year recommended budget request. You can tell it's the third year of the 2018 strategic plan. We've kind of already gone through most of these numbers on here of the reserve balance, the revenue amounts, and the expenditure amounts. We follow, if you look at the yellow row, that's basically our reserve fund balance all the way through to the end of this plan. And you see it ends at $3 million, which is where we want to keep it for cash flow issues and emergency contingencies. I put CalWorks funding out one additional year because the current application we just filled out was for a 2-year cycle, although we only know the first year allocation. So we just assume the second year will be the same amount. That might not be the best assumption at this point, knowing what we know now. So finally, the last thing I would like to do on this is to look at the adjustments that were made to this budget request to come up with our implementation plan amount, which is $19.8 million. And basically, I subtract out the CalWorks amount because it's 4.68, 4.7 million, something like that. And then another $240,000 is reduced out due to CalWorks funding covering some of the expenses that were normally built into the implementation plan. So now those don't have to be yeah, that's me.
The tape delay, isn't it?
Oh.
It's on delay.
Someone have their phone off of mute?
And then finally, I'll wrap it up right now. Finally, the last 79,000 are just adjustments made throughout the entire budget that are just minimal adjustments throughout contracts and operational accounts. And when those adjustments are applied to the $24.14 million request, is adjusted to $19.8 million, which is our implementation plan amount. And with that, that concludes my report. Does anyone have any more questions?
Okay, commissioners on the phone, any questions? Comments?
Okay, when we talked about the $1.3 million, we were talking about fund balance and why the fund balance existed. And what that meant is I budgeted, I'm going to use a hypothetical number. Let's say I budgeted $10 million for Prop 10. Well, we actually would have taken in 11.3. So that extra 1.3 goes towards your fund balance. It's not really a budget number you're going to see in the budget request. The budget number you're talking about, the 11.1 million, is actually the forecasted amount from the Department of Finance that was provided by the Department of Finance, the State Department of Finance to us. And oh, no. Okay.
Any other questions? Okay, my understanding is this is a public hearing item, so I'll go ahead and open the public hearing. We are not in possession of any electronic comments from the public.
No, sir.
Close the public hearing. This does not require a vote?
No,
No, okay. A little
the
odd.
budget needs to be voted on.
Oh, sorry.
I'm sorry, the budget does need to be approved.
Okay, I have no vote on here.
You know, some of the items on the agenda got switched around at the last minute, I
Okay,
think.
all right,
It is listed as approval.
right. Okay, I go by the red and green highlights of vote and no vote here, so.
It's making your life difficult up
Hey,
there.
you know,
Sorry about that.
Why not?
Learned.
All right, so if there's no further questions or comments from commissioners, let's have a roll call vote, please.
Chair Cerna.
Aye.
Commissioner Elliott.
Aye.
Commissioner Fernandez y Garcia. Aye. Commissioner Gordon.
Aye.
Commissioner Cossack. Commissioner Wagstaff.
Bruce, you there? No? Okay.
Commissioner Wirtz.
Terry.
Commissioner Porter. Motion passes.
Okay, motion passes. All right. Next item, please.
Next item is public hearing, first 5 California annual report for fiscal year 18-19.
No vote required on this one.
Thank you.
Just a public hearing. As required in statute, each year the commission must have a public hearing to review and take any comments and then pass along any comments that are made to First 5 California on their current annual report. The report is included in your packet and is pretty much goes over their focus areas: child development, child health, and family functioning, and as well as their program and systems improvement efforts and policy and public advocacy. Their total expenditures for 18-19 were $405 million. That includes the expenditures of the 58 county commissions plus First 5 California. And the highlights of the programs and services provided by county commissions begin on page 30, and the First 5 Sacramento's highlights are on page 43. This time around, instead of giving a big comprehensive where we tried to throw in every highlight we ever did, we just really focused in on 2 of those special evaluations that we funded. So that is what you have before you for public hearing.
Okay. Any questions for Julie? Hearing none, open the public hearing. We're not in possession of any comments submitted electronically. We'll close the public hearing. No vote on this. Any last comments by commissioners before we move on? I'll just thank Julie for her report and appreciate the summary. So
Yes.
with that, next item, please.
Presentation, First 5 Sacramento annual evaluation report for fiscal year 18-19 from ASR.
Fantastic. We have Lisa Kovig is joining us from ASR to give your PowerPoint presentation and walk you through some of those excellent outcomes. They, I just wanted to say, did a remarkable job of summarizing it. This year we did not allocate funding to do a separate sort of standalone, fancy, glossy document with all the highlights. And knowing that they, and with recommendations from our evaluation committee, they did an executive summary that really can just stand on its own and is so nice to read and look at. So thank you for that. Much appreciated.
Thank you. Good afternoon, commissioners. How are you? You're hanging in there. There's a lot of big detail stuff today. Yes. It's hard to follow a strategic plan and a budget report and a First 5 California report. So here we are. And I understand we go until 3, which means I have about an hour with you, right?
That's a good
Just
one.
wanted to see if you're still with me. Okay, I'll take about 20 minutes, though, in all seriousness. Thank you, Julie, for the introduction. And I need to turn my own slides. Okay. So first, I'll just recap the goals of the evaluation. We really haven't changed our strategy since the past couple of years, but when Julie came on board, she said, I really think we should apply a results-based accountability lens to the evaluation, and we've kept with that. So at the top of that hierarchy is the goals that First 5 Sacramento promotes, and those are the results we want to see in the community, and we track community trends, and you saw some of those in the strategic plan. But in service of those, we're looking at the performance accountability of all the funded partners. So we're looking at how much folks are doing in terms of quantity, we're looking at how well they're doing that work in terms of quality, and we're looking at whether or not anybody is better off or a direct result of that work. So think of client outcomes. The second purpose is we want to celebrate successes. We're always on the hunt for good stories and victories and wins, and we love to go get those for you. But we also want to look for areas that are sort of red flags or things that are poking out to us as being a little bit different or anomalous, and so we'll highlight some of those as we go forward. But luckily, there's very few of those. It's really just tightening up protocols here and there. Okay, the next slide is the strategic hierarchy. So I feel like this is a bit anticlimactic since you've just shown what the new strategic hierarchy will be going forward, but this is actually the first time you're seeing this as the 1821 strategic plan hierarchy. Last year when I was before you, I shared the previous strategic plans hierarchy. So it has 3 priority areas across the top, supported by 5 community goals, supported by 10 results, which as you now know have dropped to 7. And Julie explained the color coding as well in terms of when things are orange only, those are direct service results, means that's where our direct service programming goes. Green means that those are our systems change result areas. And then the hybrid is where we're using both prongs to try to get to that result for families and children. Okay, so getting into some data, I figured data would be good at the end of the day to keep us all awake. So wanted to give you some reach data. So as you know, this is the first report into the new strategic plan. So just like what you heard Julie share, each strategic plan marks a reduction from the previous one. So we are seeing slightly lower numbers than what we had in the 17-18 year. We had 50,000 duplicated clients in the 17-18 year. That dropped to around 45,000. So a small drop, but considering the drop in funding, it's pretty good to see those numbers stay that high. The next couple bars over, we show you unduplicated clients or unique clients served across different programs. So on the child side over there, just under 8,000 children being served, which is about 6% of the county's population of children 0 to 5. So that is a reduction. I think we're about 12% the previous year, but again, reduced resources. And Steve Wirtz always wants me to remind all of us that this is just really those folks that we can count through Persimmon, that there's actually a much wider reach that is almost uncountable through your fluoridation work, through your public campaign, or for your RAACD work, 211, many other approaches that are still reaching out in the community that we don't have client data on directly. Okay, so into some demographics. This pattern also doesn't change from previous years. Basically, I think because we're reaching into higher need areas of the community, the population of children served by First 5 Sacramento is overrepresented in terms of children of color. So we have a slightly higher percentage of our population that is Latino or African American compared to the countywide average. And we are underrepresented in terms of children that are Caucasian and Asian. Okay, moving into RAACD, or the reduction of African American perinatal and infant deaths. So my colleague Jordan gave a thorough presentation back in January, I think, February, a while ago. It feels like a whole lifetime ago. So I won't go through all of that data again, but just to recap some highlights. So the pregnancy peer support is one of those components that was called the cultural broker component, changed names to pregnancy peer support. Had 259 moms with deliveries that were supported. I'll go into some outcomes in the next slide. The second prong is the Infant Safe Sleep campaign, which trains parents and caregivers around safe sleep practices. And we saw really good, significant results from when parents were surveyed before they took the class, so they were still pregnant. So they reported what they intended to do once their child was born. And then we surveyed them again, or our partners at CAPSI did, to see what they were actually doing after the child was born. We saw significant changes from intention to actual practice. So great results there. The public education campaign is the third prong, and they had a slower year in 18-19 because they were closing down their previous campaigns and ramping up for what we now know as the unequal birth campaign. But they did still do the Pride and Joy community baby shower. Okay, so moving into some outcome data. Of the 259 deliveries that were supported, unfortunately there were 2 stillbirths, a set of twins that died shortly before birth, and then 1 infant death. So rolling out now into what that looks like for the community, we had some good work take place in the late spring and summer of last year with Sacramento County Public Health and Sierra Health Foundation to really try to standardize the definitions and parameters for looking at these data countywide. We realized realized we weren't totally using the same data sources and beginning points and timeframes, and so we did that work. But basically, we agreed to use Sac County public health data as both the source for birth and death data. We also agreed, because these are low-frequency events, fortunately, and subgroups can be smaller populations, that any small rise and fall in these numbers causes a big drop or increase in the annual rate. So we decided to use 3-year rolling rates. And we also agreed to use the 2012-2014 as the baseline period because efforts really started to get underway in 2015. So with that being said, here's the resulting chart that you saw back in the springtime. So this new approach to looking at the data shows us a 23% decrease in the rate of African American infant death compared to what you really see for the county, which is really no change since we started tracking the data in the 2012-2014 period. And the same is pretty much true for non-African American births, and actually a slight increase for the comparison group, if you will. So as Commissioner Wirtz always says, these are just remarkable findings to see for our target population.
Can we take this slide and turn it into a pin that we could all wear on our lapels?
Yeah.
And this is where my job gets easy, because I'm really not just picking out the fun findings and not giving you the unfun. They all are really strong findings. So take, for instance, the infant safe sleep related deaths. Now, we wouldn't have this data if it wasn't for CAPSI and the work of the child death review team data. But basically, they dig into those deaths and they find out what the causes were. And so looking at that decrease as well, 57% decrease. And remember, CAPSI is focusing on this through its parent education trainings and its provider trainings. So to see a decrease there and to see a decrease in disparity between their rate and the rate of other ethnic groups is amazing. Another prong of the strategy is focusing on one of the other leading causes of death, which is child abuse, deaths due to child abuse and neglect. So the CAN homicides is what we call those. 85% decrease in African American CAN homicides compared to the rest of the population is really not changing. That led to a 98% decrease in disparity. So almost effectively close the gap entirely. Just a teeny bit remains. Okay, so I look at those data and think something is happening with our target population that is not happening countywide and not happening with the other target groups, with the other ethnic groups. Okay, over to breastfeeding, another result of First 5 Sacramentos. So the funded effort here, as has been in the past many years, is supporting the WIC programs through the Community Lactation Assistance Program. So this year, over 3,000 mothers were supported with the help of lactation consultants and helplines. And over the years, we consistently see really good data for this program as well. So this year, again, making my job easy. So looking at the Sac County WIC, about 25, almost 26% of those moms were still exclusively breastfeeding at 6 months. I know you're happy there with that one. And that percentage is actually quite higher, much higher than the statewide WIC rate, which is really interesting. But then looking at the population at large, so looking at the national average and the statewide average, actually the Sacramento County WIC, again, considering a higher need population, is actually doing better than the nationwide average for 6-month exclusive breastfeeding rates. So I look at those numbers again and say that doesn't happen on its own. Something wonderful is at work. Dental care. So the 18-19 year marked a transition from an earlier model to a new model under Julie's leadership. So with the partnership with the Center for Oral Health, started to work with the Early Smiles program. So the benefit here is that program is connected to the managed care plans. So not only could do the screenings as we had done in the past, but now connect them to a dental home and help handhold so they can get that first appointment taken care of. So this year, they worked with 278 different school and community sites and provided screenings and fluoride varnishes to almost 10,000 children. So that number also is higher than it had ever been in the past model. So amazing reach. About 27% of children had some level of dental health, a dental need, oral health need, and 2% of those were considered urgent. 80% of families were referred to a dental home, and of those referred, 41% had that dental visit. Now I want to qualify this because there are time parameters around when we collect data. So I hope that more of those went on to have their visit after the reporting period closed, but this is the metric I'd want to keep watching in the future. Okay, I'm going to keep moving over to the next priority area, which is around early care and development. These two partnerships have been in place for quite a while as well. So through either Child Action Inc. or Preschool Bridging Model, basically the intention is to provide quality assistance and assessment and coaching and work with the children and families for sites that aren't supported by state funding and state TA. So we're looking for family childcare homes, we're looking for private centers that don't receive that kind of state assistance. So again, assessments take place. Either they are the Eckers assessment or the class assessment. Professional development plans are created, coaching, and again, screenings and referrals for children and families that need them. So Child Action had really good results, significantly so on their Eckers assessments from pre to post, and PBM Plus had also results in that same manner for the class assessment, as you can see there in the chart before you, all significant. I know my data friends on the commission are always looking for that statistical significance. Over to kindergarten readiness, probably my personal favorite area of the whole portfolio. So here the model, again, has stayed consistent over the many years. We're no longer doing school readiness assessments, but because we saw consistent data for many years in terms of those who had had your services were more ready for kinder than those who hadn't. But this set of work includes a lot of different pieces. So in the past, we had funded preschool spaces. So because of entering the new strategic plan period, I think those 400 spaces got reduced down to about 60, but Julie and her team found funding for those other spaces, so no slots were lost as a result of the reduction in First Five funding. So we did have 59 slots being funded, 97 children enrolled. First Five also supports just enhancements to the spaces, so with it, whether it's curricula or staff support, materials. Parent education and family literacy is another component, and here we saw significant increases in family literacy time with their children for those folks that did participate in that kind of education. Playgroups was a component where we saw it's such a tough thing to evaluate because it's mostly a drop-in program, very difficult to do pre-post surveying. We had some post-surveying in place there, but that's when we decided to dig in more deeply this last year and do a special study to see what was happening in terms of differences and similarities across the sites for scheduling, staffing, the setup of the room, what kind of curricula were they using, how long they retained families, developmental screens. So all the findings for you are in the report on that. Transitional summer camp, that's also a consistent component. This one we did measure with a pre-post tool and saw really great and significant findings from the beginning to the end of that program, meaning our kids are more ready now to go off into kindergarten, ready for school. And we also have health and developmental screenings happening at the districts, and I'll come back to that at the end of my presentation today in terms of a special study. This area is also supported by Help Me Grow. So the 18-19 was your first real year of doing Help Me Grow across the county. So Help Me Grow, I think, is an amazing system. We love to see counties take that on. Basically, it's a way to synchronize a system of developmental screenings. We don't want to promote screenings in the community if there isn't a place to handle children that are flagged. So that is the purpose of that system. Either send a family to Help Me Grow to receive a screening and get support, or screen them in the community and then send them to Help Me Grow to receive the support based on those results. So we had almost 1,000 calls come into the Help Me Grow call line, either again seeking a screening or already having had one, and we had 408 screenings being conducted. So here's the data point that really struck us. 52% of those children screened by Help Me Grow were flagged. So that's much higher than the average rate of 15% across the nation. So that tells us that this system is tapping into a population that has quite a bit of need. And if this system wasn't there, would those children be screened? Would they go undetected into the school system? We're not sure. So I'm very, very happy to see this effort get underway and really take a strong foothold this year. The next priority area of empowered families. So the first thing to talk about here is your 211. This has been a partner of First Five for a long time. We had almost 8,000 parents calling in to 211. These are parents with children 0 to 5. They segment the data for us that way. And they told us also what the referrals were mostly for. They were referred to family resource centers, which is great. We want to get children into one door and connect them to the rest of the services within the First Five suite of resources, if you will. And so that is happening. We also saw referrals for primary health care, children and families, CalFresh and WIC, so food support, nutrition support, and folks were requesting support for child care and affordable child care. No surprise there. Okay, and then the next thing, which was the CCGs, you just heard Alejandro talk about those grants. In the 18-19 year, we had 17 groups being funded, almost 900 families being served through those different groups, and we have a post-survey in place, which you can see the findings there. Folks are really happy. They love coming to the groups, being able to stay in touch with other members. I like the data point that told us 96% said they're likely to take their child to another First 5 program. Again, a way to open that door, bring them into the web of services. Okay, moving into effective parenting. So here I'll slow down a bit because we have a lot of new data to share with you here. So as you know, the partner here is Birth and Beyond, operating family resource centers across the county. That's been a partner of First 5 since 2004, and this really is the hallmark, one of the big hallmarks of your strategy in the community. The goal of Birth and Beyond is to strengthen protective factors, strengthen those families, and hopefully prevent or ameliorate or reduce or mitigate child maltreatment in the community. So Birth and Beyond served almost 4,000 parents in the community with wraparound services, and so that consists of enhanced core, which is kind of light touch, drop-in or resource referral type services, but then parent education, so those are more evidence-based, intensive, scheduled classes and workshops. Home visitation, which I'll talk more about, using the NPP model, and crisis intervention when something emerges for a family and they need some one-time intensive support to address that challenge. So home visiting is one, you've heard about this in previous years, but one of the main goals here is to really receive referrals for families and then assess them, see what their level of need is, and keep them as long as possible per their level of need. And hopefully we are reducing the risk for child maltreatment and reducing maltreatment. So in terms of the risk for maltreatment, the tool that's used is the Adult Adolescent Parenting Inventory, and that's an evidence-based tool that's looking at things like expectations of children, if those are appropriate or not, parental empathy toward child's needs, use of corporal punishment, parent-child role, and children's power. Children's power. So as in previous years, we see consistent results from pre to post on that tool, depending on all three groups had those same kind of changes. So that's what we want to see. Now for some new data. So different from previous years, we're able to work with CPS and with First 5 to get a child level file. So in the past, we've looked at parents and the likelihood of them having another referral into the system. But the way that the system keeps their data is by child. So we really couldn't ever compare B&B results to county level results. So I'm going to show you some new things here. First, on the prevention side of the house, and Julie was really steadfast in saying, let's not only look at occurrence of child maltreatment, but let's look at where that didn't occur. So I want to assure you that of about the 1,600 families, or children rather, that were in that data file that we ended up sharing, about half had never had contact with the system. So that's a great thing. So our goal here is to not have any of them have contact within a 6-month or a 12-month period. And so the great news here is, even when we slice it by dosage of home visiting, so 0 to 7 hours received by the parent, 8 to 24, more than 24 hours. We have some folks with unknown dosage. Really, at the overall level, we had less than 1% have their first substantiated allegation of maltreatment within a year's period. So that's great. So pretty much effectively preventing child abuse amongst this population. Does that make sense? I'm going to move into now a different population.
Which is a high-risk population being seen at Birth and Beyond just across the board.
Thank you.
And then not having a first incident of child maltreatment while in the program for up to a year afterward. It's a big deal.
Is your mic on?
So the 8 to 24 hours is, I heard 20 or 12 months, but what's the 8 to 24
Those
hours?
are hours of home visiting that the family
gotcha.
receives.
And
So
that's
0 to 7.
Okay.
And then 8 to 24, more than 24 hours. And we do have this last year was Birth and Beyond's first year of using Persimmon. So we have some missing dosage data, but that's just showing that for both the group of families that had 8 to 24 hours of service and unknown, that there was around 1% that the child did go on to enter the system. Basically, was a victim of an allegation.
Okay, sorry.
No, that's fine. And we're looking at either 6-month rates and 12-month rates. We have that ability now. Okay. So here was where we really wanted to look at countywide comparison data. So So about half the children had no prior experience, but half of them did. So about of the 805 children that did have some kind of prior experience or they were a victim in the past, about 91 of them had that baseline allegation had been substantiated. So it was a pretty significant event that they suffered. So we're really looking at that group here and comparing them to countywide rates. So of that 91, overall about 20% went on to be a victim again of a substantiated case of maltreatment. So how that compares to the countywide rate for substantiated recurrence of maltreatment is 8.7 or almost 9%. So the interesting thing to point out here is while overall our folks look like they have a higher rate of recurrence compared to the county, but that starts to change when you slice and dice the data by dosage. And that's a pattern actually that's consistent with what Birth and Beyond has found in the past. So 0 to 7 hours, the number goes up a bit. 8 to 24 hours, it goes up a bit more. They're actually, because this is a small frequency event, there were a couple of families that had a lot of kids in that particular category, and that's what we think caused that rate to jump up. But in the category of more than 24 hours of service, which is where NPP is aiming, we had no children experience maltreatment within 12 months. And then the families that have unknown service dosage, I mean, they had services, but we don't have data on it precisely in parsimony, that also is around 8.3. So I look to the far end of that bar chart and really hope that we can see those same findings again this year when we get more data into the study. Okay, so moving to the last result here, the last program rather, is for Sacramento Crisis Nursery. So we've reported on this in previous years, but as you know, this is a really special center. I got to go visit one of the locations this year myself just to get some boots on the ground and meet the staff there. But they offer overnight or emergency respite care, and we had almost 500 children receive that kind of care in the year. About 446 were daytime stays, 342 were overnight stays. And when families come to the Crisis Nursery, they do an intake assessment with the staff there. Their primary reasons for seeking care were employment reasons, parental distress, or housing or homelessness. So it's great to see folks get a case management plan being created, and then they referred back out to First Five services. So family resource centers, childcare, housing, employment services, 211, etc. So we also ask at intake what the stress level is reported by the parent. We ask that again as parents leave. We saw a significant reduction in reported stress levels from pre to post. We also ask parents at the end, just how do you feel this has helped you reduce your stress? 97% of parents said they felt like the service has helped reduce their stress level. And 99% felt that they were able to resolve crisis situations in the future. Okay, so 1920 and beyond. So we actually had intended to give this presentation, I think, in
a while ago.
January. So at that time we would have had 6 months in front of us. Now we have a month in front of us. But some of the big things, as I said, we really focus in the spring is working on those special studies. So the labor of getting all the data from the previous fiscal years off the ground, report is largely written. Now we can kind of turn our attention and go more deeply into some things. So in the area of school readiness, we really wanted to find out more about the family engagement strategies. So we realized that just receiving the quantitative data on the back end, we weren't quite sure ourselves of how those curricula were different across the sites, how they recruited families, how long they kept them, and whatnot, similar to the Playgroup special studies. So we are currently in the process of doing that now, interviewing all of the school readiness coordinators. Developmental screening is one that popped out to us too. We saw the flag rate of being only around 2 or 3%. And if we're working with school districts that are in higher need parts of the county, that flag rate should be more like at least 15%. That's a nationwide average. I would think it'd be more like 20% or 25%. So when it said to us only 2% of children had developmental needs, I thought, let's look at that a bit more carefully. So we're doing a great thing right now with the readiness coordinators, just understanding how they do their developmental screens, if it's administered to parents, if it's passed out to them, what happens when it comes back in, who looks at it, how are the data entered, what do they do when there's a suspected screen? Maybe the parent thinks there is no need, maybe the teacher does think there's a need, so how we corroborate results, and then what happens if there is a developmental need there? Do they refer to Help Me Grow now, or what happens from that place forward? And then Crisis Nursery, because again, having been there myself to see what's happening, I just felt like there are some really special studies there that we're not getting in the numbers. I mean, I just showed you numbers. They're not heartstring types of numbers. So we're out talking with staff, looking at some of those videos that they have done to try to transcribe and create more of a story there for you. That concludes my presentation on the 18-19 data. Hopefully you hung in there with me. I didn't take you till 3 o'clock.
No, that was
Okay.
very good. You can catch
At my
your breath
fastest
now.
clip possible. Any questions or comments?
Any questions from commissioners on the phone? No? Okay. Commissioner Elliott? Okay. Go ahead.
That's a fantastic question, and we have been thinking about that too. It's going to look different in all of our partner counties. So the first thing that has happened, and so I don't have a complete answer, but I think it's a great question. We'll continue thinking about that. But Julie and her team got a survey out to all the first 5 partners almost immediately to ask, how has programming been affected? How has programming changed? And so we want to keep an eye on that and see how that continues to evolve. A second thing is we were actually talking with BMU the other day, which is the partner for RAACD, and they started to get really interested in how parents are experiencing this new way of service delivery. Obviously, they're not meeting in person. So what was a home visit before is now a phone visit. So they're interested in having us do some surveying with their clients to see how is that working for them. Is there anything else that program can provide if the phone visits alone are falling short? And second to the provision of support, just how are they experiencing things in their world right now? Are there increased stresses? Perhaps they're out of work now, whereas they were working before. So we're not sure, but we're going to start some surveying amongst that population. Another thing comes to mind in terms of emergency distribution. So Julie and her team will be working with all of the different Family Resource Center sites to distribute aid, basically diapers and formula. So we're working with the team to set them up with a tracker to be able to track the distribution of that work. Beyond that, I think it's a great question, and we should be thinking about how we either understand from partners directly how they've adjusted their programs, if not find out from families themselves to the extent we can.
Hey, Carmen.
Mm-hmm. Mm-hmm.
Great.
Mm-hmm. You're right. Mm-hmm.
Julie?
Yeah, great question. And 2 things do come to mind. In that survey, we did learn a lot about what milestones our providers thought that they could reach and which milestones they thought were going to be lower as a result of this shelter-in-place order. And our home visiting contractors have been sharing even more with us about just things that they've done to change. They've been so innovative. I'm just completely impressed. I wrote a few down and thinking somebody might ask this question, but they're doing video calls, they're texting, and they might not be spending an hour or an hour and a half with a family at one time, once a week, but what they're doing is calling in on Monday, Wednesday, and Friday for 10 minutes and seeing the child through FaceTime or through whatever, just trying to get eyes in the family more often, even if it's a shorter duration. They have been dropping off materials at doorsteps, kind of like the CCG grantees, so that they'll drop off a packet for the week and then they'll do their FaceTime visit or their virtual visit so that the family has those supplies already. They've even been driving out and parking in front of a family's house so that they have a hotspot so that they can get on the internet and use it to do these things. So that providing those like mobile hotspots, they've done so much and they continue to. And our partner BMU just bought into a whole new virtual program that it's called Mommy. That is a whole new platform that not only includes what they're doing, but also their OBGYN can be a partner on it and can see and share information. It's a HIPAA compliant platform. So now they can bring in multiple partners too. It is just amazing what they've been able to do. And I think we'll find out more and more as time goes by. And then Steve, you were referring to the Child, Family, and Adult Services just put out safety tips today. These are really, for child maltreatment, these are wonderful questions that all providers can ask the families, just really timely and needed, so.
Commissioner Elliott?
Okay, well, a lot of the things I was thinking were brought up, especially with people being sheltering in place with their kids and the stress that that puts on people that already, obviously there's an unprecedented amount of stress on these parents. And one of the things that I was thinking through was the ways that we're providing service delivery is innovative and all of this stuff is exciting to hear, but I would also be curious to know what their clients are telling them that they need. So I don't, I'm assuming that they're surveying in one shape or another how their people are communicating their needs to them. Because it seems like, the FaceTime more frequently throughout the week would be effective, but maybe it isn't. Maybe there's something else that they need that they could provide. So that's kind of in the world that I operate in, for my day job, those are the types of questions we're asking our members. What can we do to meet your needs? So that is, that is so awesome. So that's something maybe to mention to them, because I think that would be good information for you guys to know.
Absolutely, and we can bring that up as a question at our quarterly contractor meeting later this month.
Yeah, Commissioner Gordon?
Just one other comment about monitoring with the nonprofits. I think it's incumbent upon not just us, but the community to monitor the financial health of the nonprofits in general, because we monitor how are they doing in executing on our grant. But a lot of these nonprofits are not on sound financial footing to begin with and are likely to really struggle. And I'd hate to be in a position where we don't know how much we need them until they're gone. And there may be some things we need to work on to help shore them up.
Thank you.
I agreed. And even with the supplies, even though we don't directly fund the CILs, we included them in the supplies survey. We'll be dropping off the diapers, wipes, and all those supplies to the 7 community incubator leads, as well as all of our funded partners, just reaching out to the broader community to provide some of that, not hardcore dollars, but supplies, hopefully, that their families need.
Any other questions or comments? Okay, great, thank you.
Thank you for your time today.
And that was just information, right?
Yes.
That was a public hearing.
Oh, that was a public hearing. Did I I haven't opened it yet, have I? Thought I did. Open the public hearing. No electronic comments from the public. Close the public hearing. And noted for the record that the evaluation report summary has been delivered to the commission. Okay, next item.
Commission member comments?
So, Carmen, hopefully you're still listening and watching. Okay. All right, so maybe the folks in the back can get the tight shot here. This is an awesome mask. So that's an example of Carmen's crafty work here to help provide masks to our first five families. I really, again, want to express my appreciation to her and everyone else that's responsible for it. Any other? Great. Commissioner Elliott?
So my last comments as a commissioner, I want to thank the contractors. Thank you, ASR. It was wonderful working with you. And again, I'll be sending out letters. This has been the greatest honor. Thank you to everyone on the phone. Thank you, Julie. Thank you, Carmen, staff, everyone listening. I will be in touch. Just like Donna said, thank goodness for Facebook and social media. So I'll be tracking everybody from Ohio. And I do hope to return. So thanks for allowing me this honor and privilege all these years. So
Good. Thank you.
Thank you.
Yeah, Commissioner Gordon?
I'd just like to make two comments as we close. First of all, I want to say a big thank you to all of my colleagues, our teachers, our other school and district staffs, our child care providers for stepping up and doing a phenomenal job under very difficult circumstances. We owe them a lot. And then secondly, I want to give a big shout out to the county staff, Dr. Bielenson, Dr. Kassiri, Bruce Wagstaff, Michelle Calles. Again, their leadership and their accessibility, our school folks have called on them at any hour of the day or night, and they have been accessible, very, very open with their advice, and most of all, they've given our folks a great sense of confidence that the leadership in the county is in good hands, and I think the data certainly reflect that. So thank you, Supervisor Cerna and Bruce and your teams. It's been much appreciated.
Great. Thank you for those kind words. You kind of beat me to the punch because I wanted to extend my thanks as I started the commission meeting with a broad thanks to our public health workers. I also wanted to thank all of our public servants, especially those working, whether you're essential or not, for the County of Sacramento. Regardless of a pandemic, we have to have your county government in operable order, and we have to continue providing those essential services. And so, again, I've made sure to thank all of our county personnel at the beginning of each Board of Supervisors here, and I wanted to make sure that I issued that those thanks to all of our team here at Sacramento County before we concluded today's first five commission meeting. Any others on the phone that would like to make some last remarks or comments? All right, hearing none, if there's no further business before this commission, we are adjourned.